But first, tell me what we're looking at.
Okay, here we have, the tooth has two portions, the crown portion, which is what we see, and is covered by enamel, which is the outer layer. It's hard, it's really, really hard. And then following that, the roots and the crown portion have underlying the enamel some dentin, which are like little tubes, tiny, tiny tubes that connect to the pulp. And the pulp is what contains the blood vessels and a little nerve. And when you get decay, as it progresses and it reaches closer to the pulp, you can get pain and sensitivity. And then when the pulp dies, then the infection travels down to the bone down here. So that's why it's so important to keep your teeth healthy at the gum level and try to keep the integrity of the enamel as well.
So when we're flossing, and we talked about the importance of flossing, and we're flossing obviously in between the tooth, and you can show us the area that we're supposed to floss.
In between,
What
yes.
happens when we don't? The stuff that gets stuck inside starts migrating inside, doctor?
Yeah, they get to cause decay in between the teeth. We call that interproximal decay. And also the gum tissue here can get inflamed, and the bone that's in between the teeth may start to be lost.
I have a question. I've noticed that when I do floss, which is rarely, and I do it gently, I bleed a lot. So is that a bad indication or something's wrong?
Correct, yes. That means there's inflammation, and very easily when you floss or when you brush, the gums bleed because the blood vessels are very fragile because of all this inflammation process that's going on.
All right.